Hi, I'm Dr. Caleb Kaufman with NorCal Physiotherapy and Sports Sciences. Today I want to talk about low back pain. Low back pain is the most common musculoskeletal injury. That means muscles, joints, nerves, all that stuff. The most common pain is low back pain. It's also the leading cause of disability. So all the work lost, all the sports time lost, all of that in the world combined, the number one cause of that is low back pain. So what I want to do is talk about what is low back pain, what is this radiculopathy, and how does it go down to your leg. The confusing thing about low back pain is that back pain isn't always caused by the back, while at the same time, back pain doesn't always appear in the back. So just to define low back pain, we're going to call it as pain that you feel in your back. Radiculopathy is impingement of the nerves as they exit the spinal cord through the intervertebral foramen. So as there's impingement in the nerves going down your legs, you can feel pain in your foot, in your knee, in your thigh, anywhere down below the back that could be coming from your low back. That's why it's so hard to diagnose. What I want to do is I want to show you how to kind of get an idea of what you can do to relieve the pain with some very easy movements. We're going to talk about something called Mackenzie's Directional Preference. What we do is we find the motion that makes you feel better and then use that as a treatment plan. So instead of trying to diagnose lumbar radiculopathy or disc bulge or facet joint arthropathy, what we're going to do is more of a movement assessment where we look at which movement feels better. Does it actually make you feel better? You're going to understand that later. And then how do we make a treatment plan based off of that? So a big concept, a super important concept that you have to understand before you even start assessing is something called centralization versus peripheralization. Now, very easily, the way to explain it is this. Pretend that you have pain in your back, in your hip, and in your thigh. If the pain centralizes, it moves up. So now you only have pain in your back and your hip. If the pain in the back is worse, but the location of pain is less, that's actually a very positive indicator. Now, the other side of that is peripheralization. That means that the pain is going down your leg. So you start with back pain, hip pain, thigh pain. You do a movement, you lift something, and now the pain is in your back, your hip, your thigh, your knee, and your ankle. We say that's peripheralization. So that means it's going further down. So even if your back pain feels better, but your leg pain feels worse, that's a negative indicator. There's a lot that you can do with this. You can go into all sorts of movements. You can do in neck movements. You can do foot movements. We're going to keep it very basic today. You're only going to do flexion directional preference, bending forward, or extension directional preference, which is leaning backwards. And we're only going to look at the low back. So don't worry about the neck and the shoulder. Don't worry about twisting and side bending and side shifting. All we care about right now is bending forward, bending backwards, because those are the two most common directional preferences. So looking at the extension directional preference group, the people that do better with extending backwards, their directional preference is to move backwards, are people that feel better when they walk, when they lie on their stomach, when they do press-ups, or when they straighten up. That kind of that's really common with disc issues. So when you straighten up, it takes some pressure off of the nerve and it allows those, it takes pressure off of the disc and allows those nerves to talk a little bit more freely. When we're looking at flexion directional preference, this is when bending forward, sitting down, activities like that seem to help decrease the pain and centralize the pain. Very commonly when we're in a grocery store, when we're out shopping, it hurts to stand and walk, but if we use a shopping cart, we get in just enough flexion that it feels better. Common occupations that I see with this are the heavy labor-intense jobs, carpet layers, construction workers, heavy lifting, and it's a lot of times the people who've been doing this for 20, 25, 30 years. A lot of times this is because there's stenosis, there's narrowing of the spinal cord, so that is putting more pressure on the spine. So bending forward opens up the central canal in our spinal column and allows those nerves again to talk better. So let's look at extension directional preference. We're going to go through the assessment that I like to do. and then we'll talk about some exercise that we can do for extension directional preference. The nice thing about extension is the treatment is the same as the assessment. So if your assessment feels good, if you start to centralize that pain, if it starts to come up your leg into your back, that's a good thing. That can actually be your treatment. So the first one we're going to do is just prone lying. All you're going to do is get on your stomach. If you're able to lay on your stomach and relax your back, and your back starts feeling better, this is a very good sign that extension is your directional preference. So step number 1 is just lying here. Step number 2 is just going to come up on your elbows. Now see what I did there? When you're bending backwards, I want your whole back to bend. Don't try to just hinge in the low back. Don't use your glutes or your hamstrings. All I want you to do is just push with your elbows so you're looking straight. So now if that feels better, you can hang out here for as long as you want. It should help. Step number 3 is going to be press ups. So you're going to put your hands on the ground. You're going to push your hands into the ground and then push your back up. Now, it's not an all or nothing thing. No pain, no gain is stupid. Get that out of your mind. What we're trying to do is find that spot that you're feeling a little bit of a pinchy, stuck feeling in your low back, and we're just holding that there. And then back down. Again, your arms should be doing most of the work. Your back shouldn't be doing much work. Your glutes shouldn't be doing work. Your hamstring should be relaxed. The only thing you should feel is the hands pushing down into the ground to lift your chest off. So whichever one feels best for you is going to be your exercise. If lying on your stomach felt good, just start there. If going on your elbows feels good, then do that. If the press-ups feel good, that's great too. Taking a step further, you can actually do that against the wall. So instead of laying on the ground pushing back, you're going to stand up, hands on the wall, and just push back. Oftentimes that's a more advanced technique because we're loaded through the spine. There's a lot of pressure going through the spine, and an injured back doesn't necessarily like that. So start on the ground, and when you're able to progress, you're going to move up, do it standing up. So now let's talk about a flexion directional preference. So the people that like bending forward, the people like touching their toes or sitting or getting in this slumped position, oftentimes the problem isn't in the low back. We want to mobilize the low back, but a lot of times we want to take it a step back. We want to look at the hips and we want to look at the thoracic spine. So 2 really good exercises for that are going to be knee to chest and then knee to opposite shoulder. That really gives a good hip stretch and it'll help decrease some of the tightness on the back. So I'll show those to you right now. Very easy. All you're going to do is line your back with your knees bent up. Knee to chest. That's all you're going to do. Bring the knee to your chest. Give it a little hug. Straighten that other leg down. And you should feel a good stretch in the back of your hip. Hold that there for about 20 seconds. When you're done, put it down and switch sides. Exercise number 2, knee to opposite shoulder. So instead of coming straight up to your shoulder on the same side, you're going to bring it up and over to the other side in a diagonal pattern. And the same thing, hold there for about 20 seconds. All right, exercise number 3. Like I said, we want to hit the hips and we want to hit the mid back. So we're going to find a roll. I'm just going to use this yoga mat right now. We're just going to roll it up. You can use a towel roll, a foam roll, anything. Squishier is going to make it easier for you. This is going to go up in the mid back, and all you're going to do here, bend up the knees, tighten the stomach, make sure you don't arch there. Elbows behind your head. You're just going to lean backwards over the mat and then back up. So it's kind of like the opposite of sit-ups. We're just mobilizing the mid-back. So I want you to be cautious with this one because if you notice, what we have a tendency to do is arch the low back. When we arch the low back, we're doing extension, which is not your directional preference. We like flexion. So if this one bothers you, if it starts to hurt, if it starts to peripheralize down the leg, don't do it. Wait a little bit and then come back to it. To get that long-term relief, you really want to get the thoracic spine mobilized. But in the beginning, the goal is just to alleviate pain. We have to decrease that pain so you can start moving better, so you can start looking for that underlying cause. Why does your back hurt? Well, because something's irritated. But why is it irritated? What's that irritation coming from? And a lot of times, just like with that flexion directional preference, it's tightness in the hips, tightness in the hamstrings, tightness in the mid-back, and the back is becoming just a victim. So First step, check your directional preference. Which way do you like moving? Second step, use that directional preference as exercise. Don't overdo it. Be calm. Too much isn't good. More is not better. No pain, no gain is stupid. We want nice, easy movement to get you through this pain, because when back pain flares up, it's nasty. I've been there. It's hard to move. It's hard to walk. It's hard to stand. So start off nice and easy. Let's just get some basic movement, see how you're feeling, and then take that next step to try to find that underlying cause.